Thank you, everybody, for spending some of your time learning more about the Long-Term Care Data Cooperative. If you haven't already been to our website, I encourage you to go visit. We are continually adding materials and resources and information there, so thanks for checking it out. The Long-Term Care Data Cooperative is funded by the National Institute on Aging under the NIA Impact Collaboratory Grant, which the Impact Collaboratory supports and builds the capacity for embedded pragmatic trials that are working within healthcare systems to test interventions for the people living with dementia and their care partners. The Long-Term Care Data Cooperative has the mission to improve quality of care within post-acute and long-term care facilities by compiling the most comprehensive data on post-acute and long-term care residents and translating those data into accessible and actionable information designed to help clinicians, managers, and policymakers improve care. And you'll hear this theme as we go and talk about the purposes for the Long-Term Care Data Cooperative. So the Long-Term Care Data Cooperative was established with 4 key purposes in mind. The first is for use in population health analytics to support operations, and this is conducted by long-term care data cooperative staff. The second is for public health surveillance to monitor medical conditions and infections, and this is done with long-term care data cooperative staff in cooperation with public health authorities, and this is on an aggregate level, so not identified. The third is for observational comparative effectiveness research. And the fourth is for clinical research studies, including phase 3 and phase 4 randomized intervention trials. So you'll see for the research, we are looking for ways to test the treatments, interventions, therapies, preventive actions, policies, and care practices that show what work or don't work for residents in long-term care overall, and for those with certain characteristics. And this is the kind of research that we think will give the most value back to the provider community that is voluntarily sharing their data. So how the Long-Term Care Data Cooperative works is that we partner with electronic health record vendors. We are partnered right now so far with 2 that are dominant in the skilled nursing facility space, Point Click Care and Matrix Care. And any long-term care organization is eligible to enroll in the data cooperative. Those that sign the participation agreement and agree to share their data, if they are a client of Point Click Care or Matrix Care, then data flows into the data cooperative, and we can start helping give them provider feedback reports and including them in the research data set. We also partner with a data engineering firm that securely ingests and makes EHR available for the key purposes that I just mentioned. So this is a provider-led initiative, and as I said, open to any long-term care providers operating skilled nursing facilities and or assisted living communities. As a voluntary data sharing collaboration between providers and researchers, this is governed by the American Healthcare Association, and any participating long-term care provider that has joined has the opportunity to participate in the provider-led advisory committee and research review committee that reviews the researcher proposals. This long-term care data cooperative did evolve out of prior data sharing collaborations between providers and Brown University during the COVID-19 pandemic. And now that we are more established, we are offering other venues for collaboration, including the quarterly town halls that we have that give providers and researchers an opportunity to have interaction, inform one another of the potential pitfalls or ways of interpreting data. So we are looking to foster those collaborations in some of the infrastructure that we have built up. You are eligible to apply to use the Long-Term Care Data Cooperative data if you are a US-based investigator affiliated with US institutions, such as including governments, federal institutions, institutions of higher education, nonprofit organizations, and healthcare systems. You do not have to have funding to access the data. If you are funded by a source other than federally funded award or an internal institutional set of funds, we do ask you to contact us before you prepare an application to use the data cooperative data. This slide reviews the partners that we have as part of the Long-Term Care Data Cooperative. I mentioned the NIA as the main funder. American Healthcare Association runs the governance. Brown University also contributes to the operations and technical review and advice for the data cooperative based on their longer term experience using these EHR data, and Acumen is our data engineering firm. We also are partnered with NIA Data Linkage to offer a link between data cooperative data and Medicare data, including claims, minimum data set data, and OASIS home health assessment data. And that is an exciting program, and I encourage you to check out NIA Data Linkage as well as a way of expanding the potential for using these data for research purposes.